Hey everybody, this is Dr. Ben Pearl with FitFootU. So today I'm in my office. I played soccer a couple days in a row, a couple hours each, and I've got a little bit of plantar fasciitis on my lateral band of my fascia. So what I'm going to do is an electromagnetic treatment. We're about to get started. You'll hear this kind of pinging, and those pinging is actually the magnetic field going into the tissue. So that each ping is a wave of the energy that is transmitting into the cells to increase cell permeability and to promote healing. There's been a lot of research that's been done that shows that this does bone healing. It also does tissue healing by upregulating the bone morphogenic proteins and other regulating enzymes and hormones that promote healing. So what I find when I'm doing the treatment itself is that the slight ebbing and flowing of the pain signal gets muted. It's almost like this kind of deep pulse massage. Doesn't hurt though, it feels actually good, and it will interrupt the pain signal. Now coming in today, this morning, first thing in the morning, it was very stiff. It's now about almost 10 o'clock, and now it's already loosened up a little bit before the treatment even. But now as I'm doing the treatment, that little bit of pain signal that's there is completely obliterated by the competing signal that I have going on in with the signaling coming from the machine. So what I'm going to do is I'm going to do a treatment for about 15 minutes. I'll fast forward to the result after the 15-minute treatment is done. And then I'm also going to be treating my knee. So I just finished treating the lateral fascia band on my own foot. And the lateral fascia is actually not as thick as the medial fascia. It's a smaller band of the tissue. There's a central, medial, and lateral band. These areas typically undergo a lot of stress. It's not like treating, for instance, the Achilles tendon, where you don't have as much direct pressure. So with undulating sports like soccer, where you're doing quick cutting across the field, it's very easy to tweak that lateral band. So I just treated it, feels a little bit better immediately. And now I've been finishing up treating my knee. So with my knee, not intense pain. I actually have a little bit of post-game soreness on both knees. I've had a meniscectomy on my left knee, but interestingly enough, taking the intensity down here, the right knee is the one that was a little bit more stiff this morning. And so typically I'll do like a 5 to 7 minute session. I might do a little bit on my left knee as well, just to kind of keep blood circulating through there. And I find that this really helps like the deep meniscus area where the blood supply is not as robust. So in conclusion, electromagnetic therapy, there's not much downside to it. It actually feels very good, almost like a deep pulse, a deep massage, but it's more deep than a traditional massage in that you're getting all the way down to the synovial joint level, and you're actuating changes there. We're going to follow up with longer term results after, just so we can have a little bit more of a longitudinal curve on how the improvement is. I'm going to tell you that right now, as I get up and come down, yeah, there's a little bit of stiffness there yet, but I do find that it's already taken the edge off. And so to the extent that we can provide more range of motion, decrease pain, lymph flow, cellular healing, these are all good things that are not going to be accomplished with NSAIDs and cortisone, and even stretching and strengthening. You're not getting the same tissue effects that you are getting with like a modality of electromagnetic field. So till next time, this is Dr. Ben Pearl with FitFootU.